Good afternoon. My name is Danielle Miller-Wagner, and I'm with American University Center for Environmental Policy. It is a thrill to welcome all of you here today for a very exciting dialogue at a very important time. We're happy to have all of you with us today. We're also delighted to be here with our partners, the American Lung Association and the Center for Environmental Filmmaking at American University. We have a long-term partnership, our three organizations. We produced a documentary last year called Unbreathable, The Fight for Healthy Air. Don't miss it, and we will put a link in the chat for how you can attend a screening. We also held a series of symposia called Clean Air for All. These were webinars, online symposia, a whole range of events talking about the importance of clean air and climate change. You can watch the recordings of those events in the website that we will also post in the chat. Our agenda for today is as follows. We will start with a 10-minute opening by Mayor Daniella Levine Cava, Mayor of Miami-Dade County, Florida. Welcome, Mayor. Following that, we will Zach Coleman of Politico will engage in a dialogue with our esteemed speakers. We'll be introducing them shortly. Following their dialogue, we will open up the questions to the speakers and moderator. And that function is available starting now, anytime. So as you have questions for our speakers, please post that in the Q&A function. And we'll make sure that they get forwarded to the group, and we will try and get through as many as we possibly can in the next 75 minutes. So with that, I would like to introduce you to our featured speaker, Mayor Daniella Levine Cava of Miami-Dade County. Daniella Levine Cava was elected as the first ever woman mayor in November of 2020, following her 40-year career as an advocate for South Florida families, both in public service and in elected leadership. As the mayor of Miami-Dade County, the mayor oversees a metropolitan government of more than 28,000 employees, serving 3 million residents and managing an annual budget of approximately $9 billion. Since taking office, she has worked to protect the lives and livelihoods of Miami-Dade residents by deploying a county-wide operation to distribute coronavirus vaccines efficiently and equitably across the county. She also appointed the county's first ever chief medical officer and has worked closely with city leaders and the business community to spread a unified pandemic response message. In collaboration with the Board of County Commissioners, she is working to distribute millions of federal dollars in American Rescue Plan relief funds to small businesses and residents impacted by the pandemic. Also, she's investing in critical infrastructure projects and kickstarting a long-term recovery. A social worker, lawyer, and community activist by training, Mayor Levine Cava was first elected in 2014 and re-elected in 2018 to serve as a commissioner to Miami-Dade County, representing District 8. She also is the immediate past chair of the South Florida Regional Planning Council and served as a member of the council from 2015 to 2020. So with that, I introduce Mayor Levine Cava.
Well, thank you very, very much for that wonderful introduction and to Miss Danielle. And I'm so thrilled to be part of American University today. I'm a big fan. And I want to start by thanking the hosts of today's webinar, the American Lung Association and the Centers for Environmental Policy and Environmental Filmmaking at American University. I am honored to be joining experts from Kentucky, Texas, and Oregon for this afternoon's discussion on the vital role that infrastructure plays in protecting the health in all communities as we confront the increasing challenges of climate change. And I can assure you that nobody is more affected than we are here at Ground Zero in Miami-Dade County. We call it our existential crisis. So while today's panelists live in very different regions of the nation, we have a lot to learn from each other's best practices for dealing with extreme weather. As well, I'll be going to Glasgow for the COPs event in November and eager to learn as in anticipation of that conversation. So we've had a long history here in Miami-Dade County successfully preparing for, responding to, and recovering from hurricanes and tropical storms. And we know the assistance that people need after natural disasters often extends way beyond the scope of what first responders need to be focused on while they're saving lives. So that's the immediate, and then there's the long term. This is true not only for hurricanes, but for all long-term threats and stressors like COVID-19 and the risks of extreme heat, which we're also paying tremendous attention to. All of these emergency situations intensify the daily challenges that each and every one of us has to deal with. And that is why my administration has been taking urgent action and allocating significant resources to prepare for the intensifying impacts of these threats. In April, we proudly became the founding member of City Champions for Heat Action. And the mayors and the chief resilience officers in nearly 24 cities nationwide joined me in this partnership that was hosted by the Adrian R. Rockefeller Foundation Resilience Center at the Atlantic Council. As part of this initiative, we appointed the world's first ever chief heat officer, Jane Gilbert, and she is exactly right for this role, having been chief resilience officer in the city of Miami and having been a prime architect of putting together our 100 Resilient City program that spanned 2 cities and Miami-Dade County. So one of her first initiatives in this role has been to work on the structure for our county's first heat health task force. Serving as the task force co-chair is Dr. Cheryl Holder, a highly respected South Florida clinician, educator, and community leader. She has dedicated her career to serving underserved populations, vulnerable populations, making sure they have access equitably to healthcare and all of the associated things that will help them lead healthier lives. As we saw with the COVID-19 response nationwide, often the communities that are most dramatically affected are also the ones with the fewest resources to handle the crisis. And that has been Dr. Holder's focus. So understanding this, our heat health task force, is going to clearly focus on equitable responses to the challenges of extreme heat. One example of how we're doing this is looking first to neighborhoods where the greatest need exists, and we expand our county's tree canopy to 30% coverage by 2030. For sure, trees are a critical aspect of cooling and provide obviously shade. They cool houses, they reduce cooling costs, as well as they're beautiful and produce oxygen. So areas with the least shade will be at the top of the list for our Million Trees Miami program and other initiatives. And we've dedicated substantial resources to increasing our tree canopy. So I want to thank our volunteers for planting first at those parks that are most exposed to harsh sunlight and also at bus stops. Many of our bus stops do not have trees or overhangs to protect people in the sun. And we know that it's those who are transit dependent who are also economically vulnerable, and they are subjected to these adverse conditions while waiting for their transportation. So when planning where to plant, we're going to take into account visibility for our drivers, pedestrians, cyclists, and transit riders too, not to sacrifice safety. And I commend the Board of County Commissioners, which serves as the policy oversight body for the county, for supporting the creation of the heat office, along with many other resilience initiatives. And these programs are helping us to strengthen our infrastructure as we build back better for our current residents and for the future of our children and our grandchildren. We have funds available at the state, and we're hoping there'll be more at the federal level to focus on this kind of infrastructure, and we're going to leverage it to the maximum possible. So in a couple of weeks, we will officially launch our new Extreme Heat webpage. So I hope you'll be able to check that out. Some of the information is already posted at miamidade.gov/heat. I was elected as Miami-Dade County's first woman mayor in November of 2020 on a strong platform focused on both environmental protection and social equity. I've been studying and tracking climate data for decades. And so I know that while extreme heat is a more recent concern for our community, we are also on the front lines of rising sea levels and groundwater tables. This spring, my administration launched the county's sea level rise strategy. So we have a specific strategy dealing with catastrophic projections about sea level rise. It's a comprehensive plan. It includes multiple adaptation approaches, many already in the works, and we're looking at where we need to prioritize critical infrastructure, raising it up, such as our fire stations in low-lying neighborhoods, also our conversion from septic to sewer. So our septic systems are being inundated with rising water tables, flushing pollution into our canals and into our bays and killing our wildlife and of course injuring our health and our economy. So our sea level rise strategy also focuses on nature-based solutions. It's not all building. Our scientific research has long shown that these natural approaches provide our best defense against storm surge. So for example, we're expanding and strengthening our county's nature-based infrastructure with everything from planting mangroves along the coasts that building up our bioswales for more runoff, native plants that are saltwater tolerant and also great at soaking up stormwater. So looking at all of these natural solutions as well as improving our physical, our constructed infrastructure. Nature-based solutions not only work miracles, but they're exactly what our residents and our tourists want, our visitors, which I hope there are many of you in the audience. Lush landscapes increase our property values, and they also protect our lives and livelihoods. We're working closely with the U.S. Army Corps of Engineers on their study of the Back Bay, it's called, region, canals and waterways that flow into Biscayne Bay to strengthen our infrastructure for the future, focused on issues of extreme weather and ways that water will inundate not just along the coast, but also further inland. We've made it a top priority to incorporate extensive community input from residents, business owners, cities, and other stakeholders. And we've prioritized the overwhelming public support for infrastructure improvements that include the nature-based approaches. So our community is aware of these conversations and has weighed in, and we have informed the Army Corps that we must proceed with significant nature-based solutions. And this spring, our county's Office of Resilience held a series of workshops in an area called Little River. It was one of our adaptation action areas. It's a neighborhood that has already been extremely hard hit by rising sea levels, our king tides, and shallow groundwater tables. The water comes into the yards, into the doorways, and so on. So across the board, residents in the Little River adaptation area wanted nature-based solutions to be a major tool, and we are making it so. So as we strategize to improve our infrastructure, we focused on opportunities, listening to our residents. And I had the largest ever community involvement initiative of the county called Thrive 305, started earlier this year. We had over 25,000 residents that fully participated. It's informed our budget, our priorities, and all of this community input truly has led to a people-powered budget for the coming year, which was approved just a week or so ago. In closing, I want to thank you again for inviting me to participate in this important webinar. By focusing on infrastructure that protects the health of all communities, we're better able to meet the global challenges of extreme weather. Thank you.
Thank you very much, Mayor. That was inspiring. It is very valuable to hear from a leader on the front line of climate hazards. And we know you've already been through your fair share, and there's a lot more to come. So we're all grateful for your leadership.
Thank you.
So thank you to Mayor Daniella Levine Cava for these very thoughtful remarks. And we're so glad you could be with us today. Now I would like to introduce you to our moderator. Zach Coleman is a climate change reporter for Politico. He previously covered climate and energy issues at E&E News, the Christian Science Monitor, the Washington Examiner, and The Hill. And he's also been a freelancer for a number of publications. He is a former Knight Science Journalism Fellow at the Massachusetts Institute of Technology and a Bill Lane Center for the American West Fellow at Stanford. Zach holds a master's degree from the University of Illinois and a bachelor's from Michigan State University. So with that, I'm pleased to welcome Zach Coleman to the platform. Thanks for being here, Zach.
Thanks for having me. And we have a very accomplished panel. I'm looking at their bios right now. They make me feel like I need to go back to school. So I'm going to introduce them right now. We have first Natasha Garnett, who is an assistant professor of medicine at the University of Louisville. She is researching health impacts of extreme heat exposure and environmental health disparities. And she is also a professional lecturer in environmental and occupational health at the George Washington University Milken Institute School of Public Health. We also have Mark Couder, who is the environmental program manager in the Office of Sustainability for the City of Austin, where Mark works with city departments to embed climate adaptation strategies into long-term operation and asset management and planning. In this role, he also supports community organizers to increase climate resilience in the Eastern Crescent. We also have Gabriella Goldfarb, who is the environmental public health section manager at the Oregon Health Authority in the Public Health Division. Gabriella joined the department in September 2016 as its manager of environmental and public health. She oversees the agency's programs to advance science-based actions that protect people from environmental threats where they live, work, and play, including lead and other hazardous exposures, climate change impacts, pesticide incidents, food safety, and more. So we're going to get into it because we've got just a short amount of time to cover some very broad sections here on resilience, climate change, and public health. So I'm going to just jump in here, and I want to talk a little bit about urban green space, which a lot of our panelists here have some experience with in their research and their work. We've seen a disparity in access to green space between white neighborhoods and those where a majority of the residents are people of color. So I want to ask two of our panelists about this issue directly, and I'll start with Natasha. What kind of health issues does this present for people who lack access to this green space?
Thank you for this question. And this is an important aspect that you bring up. And also what's concerning about it is that green space is not equally distributed among our populations. And so there have been recent papers that have shown that communities that have historic redlining have less green spaces. These communities also have higher, or I should say poorer air quality, and also have higher temperatures. So some of the health impacts that we see in these communities are related to that. Certainly chronic illness, increased lung diseases or respiratory conditions, as well as cardiovascular diseases. But there's also a lack of resources in these communities that support protection from extreme weather events, extreme heat events. So the impacts there are further compounded. I certainly appreciate this question, and the impacts to health certainly warrant greater attention in these communities that lack access to green space, but the benefits of green space are outstanding, and that we find that communities that have more access to trees, residential access to trees and green spaces, have better heart and lung outcomes, also even have better mental health outcomes as well. But these benefits of these trees and green spaces extend well beyond just the beautification of them and their ability to reduce heat and air pollution. In addition, they have benefits when it comes to extreme weather events where rainfall that would overflow or flood our roadways and communities, having more green spaces and trees, their roots can help absorb this water and help also protect our community against extreme weather. So I'm looking forward to what our other panelists have to share about this as well.
Yeah, I wanted to turn that over to Mark then. I mean, how has your department begun to conceptualize the concept of wilderness and green space in the city context? And what do those conversations look like with neighborhoods and communities that lack that space right now?
Yeah, it's a really good question. Austin is a very suburban city, so we do have a lot of green spaces, but I also want to really specify quality green spaces. And I completely agree with Professor Garnett's comments about the benefits of quality green spaces in terms of health benefits, air quality benefits, mental health, but also carbon sequestration, sort of better test scores. There's a lot of benefits, but I can't say that Austin is perfect. And there's also a lot of green spaces, particularly in low-income areas, that aren't high quality. And I say that to say that there are spaces that have more pollutants. For example, waterways where kids play that are more polluted in areas that are lower income. There are places with more, say, mosquito spreads and other sort of potential impacts. So the question is really, what is the high quality and how do we invest in that high quality in places with the greatest need? And I put into the chat what we're doing around green infrastructure, but we recently worked with Google to map trees in Austin. And I'll put that in the chat too. And if you look at this map, where we have the most amount of trees in Austin is actually the inverse of where we have redlining or where we have low-income populations. And if you look at the areas with low-income populations, it's the places with the least amount of trees. And why is that? It's basically tied to a years of investment or lack of investment based on, basically racist policies. And that we invested in communities because they asked for it, or we looked at them and then we ignored other communities, and to that detriment. So we need to change how we're thinking about things. So green spaces are great, but let's figure out how to put them in places that are greatest need to make the greatest amount of impact.
So let me follow up on that, and I will get to you, Gabrielle, as well, or maybe you can jump on this as well. But when we talk about directing investment to areas of need, I mean, oftentimes cities and states have followed a methodology in which the places with the highest property values have gotten the investments. The idea being that after a disaster, you want to have the biggest bang for your buck. I mean, is there another way in which Austin is approaching this to try to make sure that those underinvested communities do get the resources after disasters, after floods, after these types of events?
Yeah, I would expand that to before the event, during the event, and after the event. And if you think about before the event, we know what the stressors are in Austin, the same way that the mayor Cava knows that the potential impacts of weather events in Miami. We know it's going to get hotter. We know we're going to get more droughts, more rain, so more flooding, more potential for wildfire and grass fires, and then more potential for bad air quality. We know this is coming. And we also know who that impacts. So I think for us, historically, we've never asked that question. We've always invested in places that either one, we had a squeaky wheel, right? Somebody who constantly comes to city council and asks for things, but also we've always invested based on what we think is the right choice, based on our own expertise. And historically, we've sort of taken that as truth. But the issue now is that with all these big events, we're starting to see that the impacts are on those people with the least amount of resources. And we're slowly realizing that we need to invest by actually listening to people and taking that information that people tell us, the lived experience, as expertise, right? Because everybody on this call here has a degree in something. And we feel that we've learned and we are experts on these things. But we have to tie those things to lived experience. I do want to call out or reference or highlight a great professor at George Washington, Wendy Ellis, who once told me that no data without stories and no stories without data, right? We have to talk to people, figure out the lived experiences, and tie it back to our own investments and our own expertise to see how those line up. Because if we don't, we have the potential of making things worse and actually increasing cascading effects of these events. So a heat isn't just a singular event. It could actually multiply and make those communities even more vulnerable.
Mark, it's like you're reading my question sheet here, because you go right into my next topic. And I wanted to ask Gabriella about this. I mean, the Pacific Northwest baked under record-setting heat that climate scientists said would have been virtually impossible without climate change. So you were right in the thick of this summer. What were some of the heat-related stresses that your department saw? And, who did your department witness as facing the greatest vulnerabilities, and what lessons did you learn that you could use the next time out?
Yeah, I will address that. Oops, is my sound okay? I will address that, but I also want to jump in on what Mark was talking about, because I have some information about another way that we are trying to do here in Oregon that I think is helpful. But yeah, the heat dome was such a dramatic, and just one more dramatic reminder about what climate threats, intensifying climate threats, as Mayor Levine Cava, was using that word quite, often. The rapidly accelerating climate change is accelerating all kinds of climate threats. Within a year, we were the most polluted place in the world. We had, as you said, unprecedented heat that could not have happened without the climate threat, the climate forces driving it. An ice storm also, not quite on the scale of Texas's, but really big for us. And so we are seeing that climate change is affecting communities differently based on a lot of inequities. With the heat dome in particular, we saw that social resilience was one of the biggest drivers of who died. So people were isolated and low income. Those were the two drivers. From preliminary data that we're looking at, most people don't die at home. And if don't quote me on the numbers, but I think typically that number is in the 13% range or so. And more than 70% of people, of the 100 people plus who died across the state, were at home when they died. And the majority of them had incomes under $60,000 a year. So that really paints a picture for heat in particular about who is vulnerable. I wanted to address the question that you posed to Mark about another way to do things. There's a lot about what we invest in, but in Oregon, we are focusing on who we invest in, really resonant with whose voices get lifted. And we've been in conversation with our legislature for the past decade about modernizing the state's public health system. And part of that modernization need identified environmental health as a foundational program of public health that was not resourced at the state or the local level. And so the long story short, a culmination of a lot of conversations with our legislature and support from our governor, we are going to be now investing to the tune of $60 million a year with a recognition that community-based organizations are part of our public health system. We invested in them during the COVID crisis, and we are expanding that. We're going to be rolling out a request for grant proposals November 1st that is going to make available funding for a list of all kinds of culturally specific and other really all kinds of spectrum of actions that community-based organizations can take, including a focus on climate and emergency preparedness and response, depending on the needs of their local community, as well as in our tribal health partners and our local county public health partners. And none of these folks have ever been resourced to do this work before. And the first, for most of them, it's going to be assessing what are the risks, the priority risks for their communities, and engaging with each other to develop strategies that are appropriate. And that includes sitting at those tables with the people who have the degrees and informing decisions about water, land use, transportation, housing, energy, all of that. So people who can't sit at those tables because their day job doesn't pay them to be at those tables. Now a lot of those organizations will have people whose day job it is to sit and represent. So that's something we're really, really excited about.
And that's great to hear. And I'm wondering, because I'm going to assume this is the same type of social networks that would have been strained during the deep freeze in Texas as well. And so I'm wondering for everyone here, how do you go about building that capacity to bring this climate change conversation into just a social public health context? Because for me, covering climate change, I never thought about having to reach out to friends and family to see if they're doing okay during a heat wave. So like, how do you even begin that conversation, start building that capacity?
Is that directed to anybody?
It could be to anybody, yeah.
Yeah, I want to maybe give it off to Dr. Garnett if she's got any input first.
Sure, thanks. So I think that actually, Mark, you've already hit on something that's really important in terms of how do we discuss this, and that's storytelling. And there are great examples of storytelling that are out there. We, as folks that are in the health space, in the academic space, in the health department space, are prone to discussing with each other as it pertains to data. But I love the motto that you shared, that we can't talk to the public about data without telling stories. So that's extremely important. I think that is not discussed as much as it needs to be, and not strategized as much as it needs to be. But not only that, we need trusted messengers to be delivering these important messages. And sometimes that's us, and sometimes that's not us. The most trusted professionals are nurses. So engaging with nurses to help get out the word when it comes to climate change and its threats to health is vital, so that there is someone trusted that is the deliverer of the messages. But then we also need short messages that are repeated often by a variety of trusted sources. So I'm quoting Dr. Ed Maybach here, but we also need those short messages that we can all rely on and then tailor to our specific areas of expertise. All these together will certainly help get out the word, but we need to rely on the lived experiences of the populations, as both of our speakers have shared eloquently. We need to utilize that lived experience, and then we also have education and awareness that we can build among the population, where the conversation about climate change until very recently has largely not been about humans and human health. It has largely been about polar bears and ice caps, which are quite important, which have been the canary in the coal mine when it comes to understanding that there is a threat that is growing with concern. But we can shift the messages towards the people, towards the populations that are uniquely burdened by this, but also making sure that we get across that we're all at risk to the health threats of climate change.
Yeah, I mean, I think you're absolutely right. During any major event, be it a flood, a heat wave, or an ice storm, or a hurricane, the first responder is not going to be an EMS or a police officer. It's going to be your neighbor. And I think that is key to keeping your neighbors safe and our community safe. If you start thinking about, even your own neighborhood, there might be somebody down the street, Miss Johnson, who's in a wheelchair, or somebody else who you're not sure if they're even there. Like, who's checking in on those folks during a major event, so we make sure that they're safe, and who's checking on each other? Because a lot of these times, these events are not just localized to one block, they're localized to a whole community, sometimes a whole city. In the case of Texas, for the winter storm, the whole state. So we need to figure out how to increase adaptive capacity within the community. And that means, and to Gabrielle's point, that means meeting them where they are. We can no longer expect to have meetings at City Hall at 6 o'clock during rush hour and expect the community to show up when the community themselves need daycare, they need time away from their jobs. So we need to figure out how to meet them where they are. And then we also need to pay them. I think we do a disservice to the community when you automatically assume they will volunteer their time to give their expertise and their lived experience. We need to pay people. And I'm always surprised by that. We will spend hundreds of millions of dollars on any kind of road project, bridge, water treatment plant, Austin energy systems, and yet 0% on community engagement. And if we only took 1% of each project and said, we're going to use that to talk to the community about the project, it would make a world of a difference, because then the community would have ability to have input on that project. It would build trust, and it would build expectation of what the city is doing in their community. So I think without that engagement, without the that connection, we're only just going to continue to make these problems worse.
I'll just add that there's an important cross communication for the policy frameworks that are carried out by states, by other jurisdictions. A lot of these frameworks are housed in, our at the state level, our Department of Environmental Quality, our state transportation agency, or in Oregon, we have a land use agency. And it does take leadership from the top. The leadership we saw from Mayor Levine Cava at the city level, and we have had it in Oregon with our governor prioritizing equity and engagement. And so, prior to joining the Oregon Health Authority, I was a policy advisor in Governor Brown's office and in Governor Kitzhaber's before that. And it makes a difference to have that leadership from the top direct. Set the marching orders, to set that expectation and make those investments like you're talking about, Mark. And so the past couple of years, just as the COVID crisis got well underway in March of 2020, our governor issued an executive order directing a number of agencies to take up major climate work, including some assignments to OHA, but to our sister agencies who are making these decisions about cutting greenhouse gases, mitigation projects that affect transportation, land use, housing, energy, requiring that they have people with lived experience at the table who are being paid stipends to be there. So we are actually seeing that in an unprecedented way, showing that these two global crises that we had at the same time really have broken some barriers. There are a few silver linings to it, because we are seeing, I think in a lot of places we're hearing from our accounts, and it needs to happen more and more, but I think there are some signs of new ways to do this work and to lift those voices.
So let me jump off of a couple of things that the panelists here said. So Natasha, you had mentioned until recently, the conversation about climate change was often about polar bears, and it's only recently entered the public health, people-centered framework. And I think everybody here to some extent has talked about meeting people where they're at. I'm wondering, has it become easier to connect the public health implications in the communities that you serve to the energy and resource decisions that our governments and us make on a daily basis? Like, have you been able to have that conversation with people more easily and discuss what that means for our choices going forward?
That's a great question. And the thing is, it's somewhat of a misconception, but it also falls on the silos that Gabriella has brought into the conversation as well, because we've known for quite some time that climate change impacts health. In 1923 and 25, the American Public Health Association, in 1923 and 1925, the American Public Health Association issued their first statements on public health climatology. We've known for quite some time, and what they shared in 23 and 25 are the impacts that we're experiencing today. So making sure that the communication reaches the decision makers, we may see that since then, it may not have quite reached the decision makers as it needed to, so that action could be taken much sooner to protect health. But then we haven't communicated as well our wins. I think in public health, we have frequently communicated things that went wrong where we learned, but we've actually had quite a bit of wins in this space as well. Air pollution is reduced. The Clean Air Act has led to less air pollution and lives saved, and quality of life improved. Now, there is still great room for improvement. So we continue to fight this fight, but we haven't always done enough to show the successes that we've had that build evidence towards what we need. I think that we are making traction when we discuss green infrastructure, because it can be a win-win-win financially, as well as for health, as well as for communities as a whole. So here at University of Louisville, we've partnered with the Nature Conservancy as well as the National Institutes of Environmental Health Sciences. And we've partnered together for the Green Heart Project, where I like to say we're planting trees for healthier air, but it's more than trees. We're planting trees, we're planting shrubs, we're increasing residential access to green spaces. And we are able to do this in a randomized controlled trial type form. So the trees are the intervention, and we're able to look at health and air quality before and after tree planting. And then we're actually starting tree planting in just a few weeks. Later in October, we're beginning tree planting. So throughout the summer, we've been collecting the baseline information from the residents of the Green Heart Project neighborhoods. So very much looking forward to being able to dive in further after tree planting. But there's a number of aspects that are of concern here. I'm very grateful that I received a diversity supplement from the National Institute of Environmental Health Sciences to contribute further to the Green Heart Project, where we're able to also look at disparities. So we are actually in the process this moment of issuing and preparing to send out a survey around discrimination so we can understand how the toxic stress that is related to health disparities, discrimination, how that may mediate or modify the relationship between environmental exposure and health outcomes. And then we're also adding in a temperature assessment, because as has been discussed earlier in this call, we expect that exposure, the tree intervention not only can purify or improve our air quality, it can also do this through providing shade and reducing temperatures. So I think that incorporating nature into the conversation, where nature can be the intervention and where communities across the US can do this as well. They can investigate what type of trees work best for their community, will thrive, and will protect against the air quality adverse air quality experiences that they're having in their communities. I think that this certainly helps bridge the conversation, but the equity must be central to how we discuss, how we move forward, and how we design interventions.
I wanted to build on something that Professor Garnett was saying. Public health has been early on the scene flagging these issues. The healthcare sector, not as much. And so in terms of changing minds, I will tell you that this past year in Oregon, we have, in Oregon, under our healthcare reform, we have coordinated care organizations who are serving our Medicaid population. And now the light bulbs have gone off, when they saw the smoke impacts to health, the ice impacts to health, the heat impacts to health. There is now eyes are really opening that they need to be writing prescriptions for smoke filtration devices for people who have chronic diseases and are living in the wildland urban interface, where our fires are happening. So just for one example. So unfortunately, human nature, it takes wake-up calls. And so I think there is more openness to and more connecting climate to health. And actually, I think health is one of the most effective ways to get people to make that further connection to the need to reduce our greenhouse gases. So that's what we're seeing here.
And Gabriella, just to build off of the smoke, I mean, we can go smoke and heat here. I mean, what kind of relationship do people have with wildfire smoke in Oregon now? It's not something that was extremely common until recent years. I mean, what does that conversation even look like right now, where this is now becoming a somewhat constant thing? Like, what precautions are people taking, and I guess how quickly have people learned what this can really do to them?
Right. Well, I will say it's eye-opening for a sector of our state, because there are parts of our state in our rural areas, in our central and southern parts of our state, that live with smoke have lived with smoke for a long time, and they're getting even more of it. And, you know, in September 2020, we had the Labor Day conflagrations driven by climate-driven, you know, wind conditions that also were very unusual, that blanketed the entire state out to our coast with dangerous and hazardous levels of smoke. And people had nowhere to run. I mean, that's one thing that always during smoke season, at least people who had the means, certainly people with low income, people who are unsheltered didn't have access to that, but a lot of people could get away somewhere. There was nowhere to get away. And so a lot of people who had never lived with that kind of smoke had a wake-up call in our most populated areas. And we see a contrast, you know, looking at the data in terms of how many people are impacted and who was impacted. You know, last September, we saw something like, we have data about who comes into our emergency rooms, and we saw a 22% increase over what we would have expected to see for asthma-like illnesses. But for the Hispanic, Latina community, that was 30%. So we have, you know, can see the real disparity in terms of who was impacted. This past summer, unfortunately, there was a wake-up call, I think, all the way to the East Coast and even to Europe with our bootleg fire smoke stretching across the country. But for people, again, while people in our Portland area, our Willamette Valley, our coastal areas weren't impacted very much, if at all, by smoke, those other parts of the state that typically get smoke saw chronic high levels of smoke exposure. And we're expecting to see that not only that's going to be now, you know, the more typical reality with punctuated by these extreme events. But we also are expecting to have kind of a need for a lot of resources that normally we wouldn't have had, both for heat and smoke investments that we wouldn't have had to make, because the Pacific Northwest typically is a rainier, cooler place, and we are just suffering from these extremes, and getting it back to infrastructure, we're going to need to make investments that we never had to make before. So a lot of policy and financial implications for our state.
You know, we talk about how climate change can be a threat multiplier, and I'm going to go to a Texas example. I mean, pretty much any time a hurricane comes through the Gulf Coast and threatens all the refineries down there, there is a story inevitably of toxic water, toxic air emissions. If you have a refinery hit, a lot of the times you're shutting down, you know, power plants that feed those refineries unexpectedly, sometimes that lead to plumes of toxic emissions. So you have people living in the fence line of these refineries that are not only getting hit by climate change when it comes to an intensified hurricane, but also by the things that cause climate change, fossil fuel emissions. So I'm wondering, like, what kind of activism has that galvanized in any public health sense, in any community sense, in the communities that you work in, that you know, people are seeing these effects from climate change in so many different ways, and they're threatened in so many different ways. And you know, how is that galvanizing some of the fence line communities that you all communicate with?
I think you're absolutely right that, you know, we think of climate change as this external force coming in to attack us or impact us. But I think you sort of hit it right there when you said that climate is a threat multiplier, because these existing stressors and shocks are already in the community, and then climate just makes it 10, 100 times worse. And I think part of that discussion is around vocabulary. So when we go to the community and talk about climate resilience, I think most of the community, particularly communities in East Austin, sort of look at us confused, and they're like, well, we already are resilient. We lived through these floods and through these events. So for them, the word resilience is abstract. But if we start talking about social justice or the environment or pollution, then they know what we're talking about, because they've also experienced, you know, decades of oil refineries in East Austin or these other industrial uses next to their homes, and they've been impacted by bad air quality, by the smells, by polluted water. So for them, I see them, these communities, I think it's really about how you talk to them and being open to hear what they say and talk in a way that makes sense, right? Because if we talk with really high level words or concepts that are, really attractive to us, it doesn't always resonate with the people we talk to. So ensuring that we have a similar vocabulary is really important.
I'm of course muted. And on that vocabulary, there is a question from the chat here. In people want to know, how are you all defining high need? Like, does it mean low income? Does it mean a high proportion of Black, Indigenous, and people of color? Does it mean pollution burden, housing cost burden? How are we conceptualizing high need?
My answer is yes.
Yes.
We spend a lot of time mapping quote unquote social vulnerability by looking at, 30, 50, 60 layers of data to see what sort of springs up. And the more we looked at it, the more we realized they're all interconnected. They're all basically saying the same thing. If you're looking at, in fact, I just put one study we did into the chat. If you look at wealth, language, age, income, communities of color, all of this data, it will give you the same maps. And these are all the maps that rely back to, or connect back to something Professor Garnett said is redlining and historic city growth. So how do we define it? We typically